How does the Global Fund help control global TB? Imagine a world where tuberculosis is no longer a deadly threat. The Global Fund is working towards that goal by providing vital financial support to fight TB worldwide. Since its start in 2002, it has invested over $10 billion in TB programs and nearly $9 billion in programs that address both TB and HIV. This makes it the largest supporter of TB control efforts around the globe. The Global Fund helps countries with fewer resources by giving grants based on their specific needs and plans. These grants support activities like early diagnosis, effective treatment, prevention, and strengthening health systems. They work closely with governments, non-governmental organizations, and private partners to make sure programs are well implemented and reach as many people as possible. One of the biggest impacts is improving access to diagnosis and treatment. Thanks to the fund's support, more people than ever are getting diagnosed and treated for TB. In 2023, about 75% of TB cases were treated, up from 45% in 2010. The fund also helps introduce better diagnostic tools, including rapid tests that can be used near the point of care, so patients can get diagnosed quickly. This means fewer people suffer and fewer spread the disease. The programs also focus on treating drug-resistant TB and TB in people living with HIV, which are more complicated cases but very important to control. Prevention is another key part of the Global Fund's work. It supports preventive therapy for people exposed to TB, helping stop the disease before it starts. Millions of individuals receive preventive treatment each year. The fund also invests in research for new vaccines and preventive tools, aiming to introduce more effective vaccines into national programs in the future. Thanks to these efforts, TB deaths worldwide have dropped by 40% since 2002, and the overall death rate has decreased by more than half. The number of new TB cases has also fallen by nearly 30%. These improvements show how effective coordinated funding and strategies can be in reducing the burden of TB. The Global Fund also helps strengthen health systems by training health workers, improving data collection, and ensuring quality care. This support helps countries sustain their TB control efforts over time. During challenges like the COVID-19 pandemic, the fund has helped restore TB testing and treatment services, ensuring progress continues even in difficult times. It also addresses co-infections like HIV, which can make TB harder to treat. In summary, the Global Fund's comprehensive approach, funding, prevention, diagnosis, treatment, health system support, and innovation, has played a crucial role in reducing TB globally. By working closely with countries and tailoring solutions to their needs, it helps move closer to ending the TB epidemic. For anyone concerned about TB, it's always best to consult healthcare professionals for personalized advice and care.